I'm fine, thank you. Yeah, good to see you.
You too, you too. Hi everyone, thank you for joining us this evening. I'm Olivia Quadri, I'm a trustee at the Public Health Collaboration, and we have a great guest tonight. We have Helen Gowers, who's the director of our Lifestyle Club service, which we'll be talking about this evening and at our conference. So welcome, Helen. Thanks for joining us this evening.
Yeah, thanks for having me on.
That's no worries. And what we're going to do this evening is similar to this format that we've been doing for the series of Instagram Lives, where we are looking ahead to the conference. We're going to ask Helen about what she'll be planning to talk about at the conference, as well as what she's most looking forward to about it. So hopefully everyone will get a good overview and join in the excitement that we have for what's going to be happening in just a few weeks' time, 6 weeks' time, in fact. So Helen, before we get into the actual what you're going to be talking about, maybe you can just give us a little bit of an introduction to yourself and how you came to be in this space of nutrition that we're all in at the moment.
Okay, so as you've said, I manage the Lifestyle Club, which is a health coaching service for adults with type 2 diabetes that's been developed by the Public Health Collaboration and really draws on all of the experience that the charities had through the GPs and the healthcare practitioners that set it up, but also through ambassadors that have been running local patient support groups with low carb. So all of that came together to create a fantastic 8-week course, which we're commissioned by primary care. So GP surgeries can buy our package and then make it available to their patients. And we've been doing it now for nearly 3 years. So it's really exciting. We've come such a long way in that time. And that's essentially what I'll be discussing at the conference.
Yeah. And obviously that's a course that was based on the thinking of Dr. David Unwin, who is the chair of our scientific advisory committee. And it's one that we talked about yesterday. A few of you are already asking about Eddie Abu, who we had an Instagram live with yesterday, and where we also discussed the Lifestyle Club, and we've had loads of inquiries since then into what this is and how people can avail of it. So hopefully this is the service that we were talking about yesterday for everyone online, and Helen can answer questions as we go as well about it. But hopefully a lot of them will be answered as you tell us a little bit more about it. So what more would you like to tell us about the Lifestyle Club? So what exactly happens in this course? How do people get referred onto it?
So it's basically, as I say, it's commissioned by GP surgeries, and they will send out text messages to adults with type 2 diabetes or pre-diabetes that they feel would benefit from this approach. We run an information session to start with, so people would just sign up, come and find out a bit more about the course and our approach and the low carbohydrate diet, and just all the support and the things that are on offer as part of our package. And over 80% of people that come to one of those information sessions will sign up. And the course usually starts about 2 weeks later. It's an 8-week course. Each of the sessions is an hour and a half long, so it's plenty of time for people to really get to know each other. We limit the classes to about 12 people, and that's a really good number. So there's lots of discussion. People can compare notes and share recipes, and it's amazing what you can learn from hearing about everybody else's approach to this. So lots of learning going on. And because it's 8 weeks long, it gives everybody time to really experiment and see what's going to work for them. We set up a WhatsApp group, so there's plenty of discussion that goes on in between the classes. And then at the end of the 8-week course, we do a whole program of follow-on support. And I think we're probably the only program that offers lifetime support to their participants. And so we want everyone to stay engaged. We've got a Facebook group. We have WhatsApp groups that are specific to different areas. So there's one just talking about fasting, there's one talking about exercise, another one talking about low carb. And we do monthly catch-ups. So actually tomorrow we've got Dr. David Kavan's going to be coming and talking to everybody. He's a consultant endocrinologist and really very experienced in low carb. He's written lots of books on the subject, and his latest one is all about remission, achieving remission with low carb. So we'll have guest speakers, and really just to keep everybody engaged, and they do so well. We get such lovely feedback when people have finished the course, and a lot of them just say, this has changed my life. It's something that I've been battling with for 10, 15 years. Why didn't anybody tell me that actually this is what I need to do? So it's just so heartwarming. And the health coaches sort of share their latest good news story. And yeah, it's a really lovely space to be working in.
Yeah, absolutely. We've had so much positive feedback on it, haven't we? And can you tell us a bit more about how many people have been through it and how many GP surgeries there are that are offering it and whereabouts they are, so people have a bit of a sense of the scale at the moment?
Okay, so we're growing. So we've now picked up a few more primary care networks. That's just a group of GP surgeries. So we've got them all over the country, and that was just by chance that they've happened to have contacted me and set up. So starting at the top of the country, we've got Sale and Bolton and Nottingham. And then coming down, we've got Aylesbury, Guildford, Winchester, Chichester. And then over down the left, we've got Weston-super-Mare, Bristol, Devon, and oh gosh, have I missed one? There might be another one. But yeah, so 10 PCN in total of 53 surgeries now are signposting their patients. And since we've been running, we've had over 1,200 participants go through, and lots of them stick with us. So there's over 200 people on the Facebook group, I think, and over 100 on each of the WhatsApp groups. And then I send out a newsletter, so a lot of people aren't so interested in social media, but they hear all the news through the newsletter.
Excellent. And can you tell from those groups how many are continuing with eating the right way, and whether any of them fall off and need some help coming back on, or what happens in the longer term as you see these people progress after the course?
Yeah, so I think that's the reason why we need lifetime support, because making these sorts of behaviour changes, it's just a roller coaster, isn't it? So life is always going to be throwing things at you. So maybe somebody does really well on the course, they lose a load of weight, and then some crisis happens that spirals them off, or even just Christmas happens. It doesn't have, or Easter, it doesn't have to be a big thing, but something that just breaks the routine, and they just need to get back on track. And because they know that we're always here, even if they don't want to be checking in with us all the time, as soon as they have that crisis, they know where to come, and they can be reminded of all of the recipes and the things that are available for people following low carb, and just feel supported to get back on and carry on, and be reminded of all of the benefits of doing it, how much better they feel. So yeah, it's just a really nice community.
Yeah, that's fantastic. And what kind of feedback do you get, or do they get from their GPs about the course? And do you hear much about what the primary care thinks about this?
So I work really closely with some of the surgeries. It's interesting that they're very different in the way that they commission us. In some PCN, it's really down to the individual surgeries, and I'll be in touch with usually the practice manager and maybe one of the nurses that's particularly interested in low carb. In some of the others, it's been all managed at the sort of PCN level, and almost an operations manager will send out the text messages, and there's very little communication with me and the GPs. But I think that's one of the things that it started to dawn on me, is actually this is a really good education opportunity for the clinicians. And so this year we've set up a page on our website that's just for clinicians that are commissioning TLC, so they have access to all of the research around low carb. They've got access to free webinars and learning, tutorials on low carb. What else have I got on there? There's a Telegram group. So I've set up a forum where they can communicate with each other. So they've got access to clinicians that have been using low carb for a long time, which has worked really well. And yeah, I think that's just something that we'll be able to build on as we get more surgeries signing up and more interest in this. And I'm hoping that we'll be able to help educate them. And actually, the access to the conference, they have free access to the live streaming of the conference. So yeah, it all feeds in to just raising awareness about metabolic health and the importance of nutrition in that.
Sounds amazing. So We had some great news recently about this service, because as it's been growing, as you described, Helen, we've also been able to get some recognition for us. Would you like to tell us a little bit about the awards that we
I know, yeah,
have been bestowed upon us with the
exactly.
Lifestyle Club?
So, well, we actually won an expert award earlier in the year, or it was December, where they look at all of the uh, brands, the sections of the NHS that have used expert courses. And they're very kind to include us in that, because we're not strictly speaking an expert course, but we entered their competition, and we were awarded the most improved waist circumference and weight loss across all of their people that use the expert system. So that was very nice. That was for the second year running. And then the big one is the HSJ Partnership Awards, which is sort of like the Oscars of the NHS. So all of the big names were there. And we entered the competition thinking, well, we're so new and we're so small that let's just enter it and see how we get on. And it'll be an opportunity to practice doing the application. And I'm sure we'll learn something along the way. We certainly didn't expect to win anything, but we thought maybe we'd get shortlisted in one of the categories. And we actually got shortlisted as finalists in 3 categories: in Best Charity, Best Project in Preventative Healthcare, and Primary Care Project of the Year. So we actually had to raise the funds in order to be able to attend the awards dinner, because that in itself was really expensive. So we were very kind that one of our benefactors helped us to actually get to that. So a few of us went to the meal and sat through, what it's like, where they have all the nominations, and it's sort of 2 hours to get through. And we didn't win the best charity. In fact, we didn't. They had gold, silver, and bronze in each category. We didn't win anything for that. We didn't win anything for the preventative healthcare, which is the one that I thought we might. The judges have been quite kind to me on that one, but no, nothing. And so really we'd given up, because the primary care project people had been really mean. And I just thought there's no way that we'll get anything for them. And then we were announced, and we got the silver award. So it wasn't even that we squeaked in with the bronze. We actually got the silver award for primary care project of the year, which was just astonishing. So I'm just really hoping that raises our profile. It so validates everything that we've been doing, because the judges for this competition are really high up in the NHS. They're key managers that are looking at strategy and innovation across the whole of the NHS. So the fact that they wanted to make us finalists in 3 categories, and then we actually won silver in 1 category, when you look at the stiff competition we were up against, I'm just delighted. That was really, really lovely to do that.
That's fantastic. And aside from having, more exposure, what else do you think that award could mean as far as scaling up within the NHS?
So already I'm starting to, people are opening doors where before perhaps they were just shutting them in my face. So, it's definitely going to make a difference in terms of when I pitch to PCN, or when I hopefully pitch to the next level up, which is the Integrated Care Board, which is basically groups of PCN, so large groups of surgeries. They're just more interested to hear if I've got this award to tell them about, then we're worth listening to. And I think it just shows that low carb is becoming more accepted. There's been a huge amount of research done on it, and there's just no reason now why it shouldn't become mainstream. And I think everyone's waking up to that fact. So the door is definitely opening, which is really good news.
That's right. I mean, David Unwin also published a paper last year with Roy Taylor on some of the longer term outcomes of eating this way. Is that something you can tell us more about, and how it relates to Lifestyle Club?
Absolutely. So the paper, again, I think it's the top performing paper for BMJ nutrition, and that's a prestigious journal in its own right. And he did it in combination with Professor Roy Taylor, who is behind all the soups and shakes and the meal replacement research, and massively respected. He came to our conference last year, which was great to meet him in person. So that research paper, they found that 51% of patients that Dr. Unwin has can achieve remission. But actually, the number of people that were diagnosed within that year achieving remission was over 3/4. It was 77% of people diagnosed within that year can achieve remission in this, using this approach, which is astonishing. The other thing that they looked at is what happens to people that don't achieve remission, because to achieve remission, you've got to get your blood glucose levels back to normal, and you've got to come off all of your medication. And there's some people that are never going to be able to do that. Maybe their pancreas just hasn't got the wherewithal to be able to produce enough insulin now. Or maybe they'll reduce their medication but not be able to come off it completely. And when he looked at all the other people, in fact, when he looked across all of his participants, 97% of them did better on low carb. And there were only 3 that said, actually, there's a reason why it's not so good for me. So again, most people do really well on this. And I think the key thing, which obviously commissioners in the NHS are most interested about, is he's saving £68,000 every single year on his diabetes drug budget by just not using medication. They're using diet and lifestyle as their first approach. And if we scale that across the country, it's going to save millions of pounds for the NHS. So that's essentially what TLC is trying to do. It's trying to show that we can scale this up. And I suppose the other thing to mention is our research study. We started our research study with the University of Surrey in January. We've already recruited 25 people to the study. So they've all gone up to the university, they've been measured, they've had blood tests, and we're hopefully going to be able to report on remission rates, because that's something that's always been really difficult for us to do at TLC. Because we're in collaboration with the clinicians, we don't have control over when the blood tests are taken. So it's just nice to be able to have that third party to take all of the measurements and hopefully make our data just that bit more robust.
Yeah. And you've been talking, Helen, a lot about how we are offering the service via different GP practices and ICBs, and trying to get it offered through those kind of mechanisms. And I just wonder if you could explain for people out there who are interested in TLC in general, either for themselves and accessing that course personally, or whether they know somebody that maybe they want to make sure can access it through their own GP practice. What options do they have as to what they can do at this point in time of rolling out the Lifestyle Club?
So we always come back to the fact that we are still really small. So whilst we're delighted we've got 53 surgeries offering TLC, that's obviously not going to suit most people in the country. So for people who have TLC, that's fine, and speak to your clinician, and I'm sure they'll get you onto it. But for everybody else, it'd be great to just go and talk to them about what you've heard on TLC and see whether they would be interested, because that's one of the ways that we're going to be able to scale this up, is by people engaging with their healthcare practitioner and telling them about what's available. But while they're waiting for TLC to be rolled out in their area, the Public Health Collaboration charity has been creating free resources that anybody can use. They're all available on our website. Liz, our ambassador coordinator, has recorded 8 sessions, very similar to TLC, talking through all about low carb and what to do. And so you can watch those for free. If you're interested in having the support, you actually have to sign up. So you've got to fill out the form that's on the website, and then you can attend weekly support sessions and access all of the recipes and all of the resources that she's put together. So it's not TLC, but it's very similar. And then also there's the Freshwell. I'm sure you've mentioned that already, but the Freshwell app is available to everybody for free. So again, that's a really good resource for low carb.
Yeah. So it may not be TLC, but it's like a pseudo TLC, and you do get the same
next best thing,
pretty much.
Exactly.
That's right. And if someone wants to make sure that maybe their relative is particularly keen to follow what their GP says, that they can do to speed up their GP in accessing TLC, is there something they can do to make sure their GP knows about it and try to get through that way?
So on the Lifestyle Club website, there's a button where you can download a sort of template email or letter and take that round to to GP, and it sort of, in fact, I'm not sure I've added the bit about the award. I need to get that on there, but you know, it will be
On there.
explaining. Definitely, I need to get that on there, but it will explain to the GP what we're doing and what they need to do to essentially just to get in touch with me, and everything else will be really straightforward. And just for any clinicians that are listening, it's very, very simple. Their input is essentially to search their database for patients that would be eligible and send them a text message. And really, we just do everything else. The only time that they might need to do something else is if the patient is doing so well, they need to come off their medication. And then, you know, the health coaches would advise people to speak to their healthcare team about that. But I can't think that they would be disappointed if, you know, they're having to take people off medication because they're getting better. So it's a nice outcome to have.
It is, and it's a service that is our flagship service. I think you mentioned before, and we're really proud of where it's going. And at the moment, as public health collaboration, if many of you probably follow us, you'll know this, but if anyone doesn't, we aren't just providing free information, free resources and education to the public, which is all available on our website and on our YouTube channel, but we are also making the changes to the healthcare system that we want to make sure is going to protect everyone from poor metabolic health and try and help them bring that back to good metabolic health. And so the Lifestyle Club is our flagship service that we are partnering with the NHS to offer. We also have other services similar to that kind of approach. One is called Liberate, which is a service that we're piloting to help people reverse food addiction, which is a serious inhibitor for many people towards achieving good metabolic health. And we are also piloting a schools program where we are looking to change aspects of the education system and introduce a module where the younger generation are able to understand early on what real food is, what ultra processed food is, and the dangers of it, and to be equipped themselves with the right knowledge to make good decisions as they develop on what nutrition they should be is best for them in their development years. So we are putting together these types of programs because we want to make sure that where there is poor metabolic health, we're able to help people in the system, and also we're able to use the system to prevent future poor metabolic health. So we are a charity which doesn't take any funding from industry and is doing all of this as a not-for-profit. So we really do rely on the support of the grassroots community out there, and anyone listening to this will hopefully agree that we're a charity that's worth supporting. So the best way to do that is to come to our conference, and that is the main event of the year for us. We're all very excited about our annual conference, which is going to be in London in May, that I mentioned that Helen would be speaking at earlier. And so we're looking ahead to it at the moment, and Helen will obviously be talking about the Lifestyle Club, but we have a really packed schedule for 2 days with some fantastic speakers and many of the kind of best thought leaders in metabolic health coming in from all over the world to tell us the latest about some of the best topics in nutrition. So Helen, I don't know if you have looked at the schedule recently, but is there anyone that is kind of catching your eye as to who you'd like to listen to or to meet while we're there for those 2 glorious days?
Absolutely. So Ben Bickman and Dave Feldman I have met already, so I'm looking forward to seeing them again. And so they're good things, and Ben just explains everything so well. You know, his talk last year on insulin resistance was amazing. So yeah, that would be great to see them. Dave I met for a meal up in London when he was doing his filming for his new film all around his study, and so I'm interested to hear what he's been doing in the meantime, because I know there's been a lot going on in the conference that he ran. So the other people that I'm interested to meet, Gary Toves, I don't know too much about, which is shocking really, but that he's obviously going to be very interesting to talk to, particularly given my interest in diabetes. And then Ken Berry, I haven't listened to that recently, but he was one of the very first people when I found out about low carb. He was doing a lot of stuff on social media around low carb and the benefits. And so I remember listening to a lot of the stuff that he put out there, probably about 3 years ago. So that would be good to catch up with him. I think the other thing is the discussion that's going to be on ultra processed foods, because a lot of people that have type 2 diabetes do have that sort of tendency to food addiction. So it's an area that I'm very interested in, and certainly the work that Ellen's doing with Liberate, I'm sure we'll be collaborating between the two, and that people that are really struggling on TLC will benefit from having a few sessions through Liberate, just to help them understand their relationship with food, and then they can come back and learn about what they're going to do to actually reverse their diabetes. So the two things go hand in hand. And then the last one that caught my eye is Ian Campbell, because I've heard him speak before, and again, he's very, very listenable too. We had a conference up in Edinburgh that he spoke at, and so the stuff that he's been doing up in Edinburgh on mental health and bipolar, I think, definitely it's the topic of the moment. That's the one that everyone's talking about. So it'd be interesting to hear about that.
Yeah, absolutely. And there's just so much as well. Every time we go through this schedule with anyone, people struggle to figure out which one is going to be their favourite. But as you say, like a fantastic type 2 diabetics panel with Gary Towles and Ken Berry and David Unwin, who we must forget is our scientific
exactly. So I better think of something to say against that lot. Yeah, I get my two pennyworth in. Well, I think the thing about the conference, if people haven't been before, it's unlike anything you'll ever been to. It's like a massive family. Everyone's so friendly, and there's no sort of barrier between the top names and everybody else. You just mill about and talk to everybody, catch up with people that you've not seen for a while, and yeah, just really very friendly atmosphere. Lots going on.
Yeah.
So yeah, it'll be a great event.
We're quite excited to have to be talking about the schools program as well. So you're going to be covering a little bit about the lifestyle club earlier on, and then we've got Chris Hill, who looks after our schools program and is piloting that, is going to be talking about it in the afternoon, along with Leah Keith, who is going to tell us her story as someone who grew up and made nutritional choices quite early on that were detrimental to her. Is going to be sharing that personal story as well. So a lot of people are really looking forward to hearing from Leah, who wrote The Vegetarian Myth. We've also got, as you mentioned, Dave Feldman, and what we really got a lot out of last year was many people fed back that they really enjoyed the format of having an open debate on a topic of nutrition, that people don't necessarily always have a chance to hear both sides, like compared to each other and contrasted directly. And so this year we were actually repeating that. So last year we did Do We Need to Eat Plants? And this year we're doing Does Cholesterol Cause Heart Disease? And we're doing a second debate, which is Does red meat shorten lifespan? And so on the first one we have Dave Feldman discussing some of the latest findings on cholesterol with one of the most mainstream lipidologists that there is, who really believes that cholesterol is absolutely causal in heart disease. And so it will be really interesting, I think, to hear, this major topic in nutrition being discussed by some of the best thinkers who have very different viewpoints, and seeing how that comes out so people can make up their own mind. And then similarly on the other day of the conference, the red meat one, we will have Dr. Anthony Chafee and Ben Bickman both talking about red meat not being an aspect of a shorter lifespan, and talking with experts who believe that it does have some role to play there. So again, trying to kind of really take on these thorny aspects of nutrition that people have quite polarized views on, and try and give the public information where they can make their own choice with directly comparable information, and a discussion that can go back and forth on some of the points.
I think the key thing is that nutrition is incredibly complex, and one of the things that has led to us just getting so confused around diet is we've tried to simplify it. And so that's why it's so important to hear everybody's views, because probably the correct solution is actually somewhere between. That there are so many nuances, and we're all so different in the way that we respond to food, that there isn't just an obvious answer that is the answer. And so that's what's great, that we're just debating this in just a mature way, that way that the discussions were handled last year, I thought was very, very sensitive and really allowed everybody the space to actually share their understanding.
Yeah, yeah, thank you. That's definitely what we're aiming for. And hopefully we'll move the conversation forward, in the nutrition world, in the scientific nutrition world. And finally, on the Sunday, we're going to be ending with the discussion about ultra-processed foods, and we'll have Eddie Abu on that panel. And his take is very different from all of us in terms of should we get into the science, because his view is just eat real food and that will give you your answer. That's the experiment you need to do.
The thing I listened to most of your talk with him yesterday, and the thing that struck me is his passion for cooking, because obviously I did 20 years as a food technology teacher, and so I love teaching people to cook. And how sad that as a society we now just turn to manufactured products without that desire to make food for ourselves and to share that with our children. So that's great. I love the fact that he's really promoting cooking food for yourself.
Yeah, no, he's going to be great as well. It's so exciting. So hopefully that is going to whet everyone's appetite, who's either coming along, or if you're not, then please consider it. The best way to support us, as I said, is to come to the conference. And it's also, I'd say, even though we are offering live stream tickets, it is definitely, I think anyone who's been along would recommend being there in person.
It's very special.
Yeah, the atmosphere is incredible. You make loads of connections with people you never expected. Everyone says that they go away on such a high, and they're inspired for many months to come. And that's probably not captured quite as much on the live stream. But if you can't come along in person, then do please consider live streaming in as well. You get to watch it as it's happening, obviously, but also you get to submit questions via the app, even if you're remote, and you're able to watch it back for I think a couple of weeks afterwards as well on the same app. So
I think the other thing
in the same way.
I'm presuming it's Steve that's going to be managing all the live streaming, and because that's his business, he runs a TV network. It was done so professionally last year, and all of the splicing everything together while somebody's talking with all their slides, and God knows how they manage that. But I'm sure the live event will be absolutely amazing, although not quite the same as being there in person. It would be a good substitute.
Exactly. So the best way to support us, and if you do for no other reason than to support us, then just come along. But we really believe you love coming along. So hopefully people will go ahead and book their tickets if they haven't yet. And also just want to highlight that on the Monday, so the conference at the moment is the Saturday the 18th, Sunday the 19th of May. But on the Monday we also have a workshop for anyone who would like to use all that inspiration that they've just acquired from the conference and channel it towards real change. And we've got some fantastic metabolic health experts on Monday that are going to work with people in the morning on any individual nutritional plans they want to put together, and also in the afternoon to think about how everyone can be part of a wider change. And we're really excited about that workshop. Actually, it's looking really good. We've got there's not that many metabolic health GPs in the UK, but two of them are going to be there and do this very well and do this all the time. And so it's quite a rare experience to get access to these types of experts. So I would really recommend anyone who can stay for the Monday. It's really going to be worth it.
Aren't they aiming at both clinicians and members of the public? I think they're hoping that everyone will come. Absolutely. And then I don't know whether they'll divide people into different groups, but the idea is that whoever you are, there'll be something to learn.
Absolutely, yes. And we're going to have, for the whole conference, in fact, it's for both healthcare practitioners and the public very much. And but on the Monday, yes, you're right. It will be streamed in actually two different streams, so that there will be a slight separation of depending on what you're most interested in. But yeah, it will cater for both. So it doesn't matter what your perspective is. It would be a great additional session to stay for on the Monday if you can. So yeah, so that's our conference. Helen, is there anything that you want to leave as a final message to people about the Lifestyle Club or anything that you're doing in particular, and also just remind us where people can continue to follow you?
So takeaways, definitely come to the conference, and I think for the Lifestyle Club, particularly having won that award, I just feel the doors are opening, so it's very, very exciting. I hope that there will be even some things happening between now and the conference that I'll be able to report back on. So yeah, do come along and just enjoy the excitement.
Excellent.
In terms of how to contact me, I've got my Twitter handle and my I don't know about my Instagram actually. That's probably the harder one to find, but it's Helen P. Gowers, and both of my LinkedIn and my Twitter are the same. I can't remember what my Instagram is. It might be something completely random.
No, it's the same.
Is it the same?
Helen P. Gowers,
okay,
yeah.
all right, that's good. Yeah. Yeah, or just through the Lifestyle Club or my PHC email account. So
okay, we'll put those
in the notes.
In the notes, yeah. So that is all I was going to ask you about tonight, Helen. So hopefully,
thank you.
It's given people a bit of a feel and a bit of a sense for what's coming up, both in terms of what Helen's talking about and the wider conference. And we're really excited. We're excited for the future and everything that the Lifestyle Club could bring to our charity, but also to society in general. So really going to have to keep an eye on it as we continue to grow it.
Fantastic. Thanks, Olivia. I'll see you soon.
Thanks, Helen. Have a good evening. Thanks everyone for joining.
Thank you, and you. Bye-bye. Thank you. Bye then. Bye.
Bye-bye.